First, thank you for the invitation. You know, this is my fourth time in Germany in 6 weeks. And then when I came on the flight, I said I need to buy a home in Germany in order to stay there. I have a lot of friends in Germany, and now we see that we are sharing a lot of information. And today you will see, you will get a very nice update in the information. We will talk about today the osteo-immunology. What is osteo-immunology? It's a new science that came in 2000, but why it's interesting to change? Because today we have the evidence that osseointegration and bone loss are managed by the immune system. We have an immune system. We have two immune systems. One is the innate, means when you're born with. The first minute when you come in this world, you are able to defend yourself against microbes. But this immune system is responsible of the tissue remodeling. Any tissue that remodels is under the control of the immune system, like bone. But we have also the adaptive, means we learn when we meet microbes, etc., with the lymphocyte, the T, and with the B that are producing antibodies. So, what is the link between bone and immune system? We know that the immune system is influenced into the osseointegration because osseointegration starts by an immune reaction, inflammation. We know that immune system is a key factor on homeostasis, means stability. We know that the immune system controls bone formation. And we know that the immune system regulates the bone resorption. It means that the immune system controls everything in the life of the bone. But the bone influences the immune system too. And this is why, since only a few months into the science, we consider that we have only one system, the osteo-immune system. Their systems are very, very close. So, we need to talk about the first, the inflammation. But maybe you don't know this absolute important information, that this inflammation should last maximum of 5 days. Must be brief. We need to stop the inflammation at the 5th day. Because during the 5 first days, this inflammation will help us to heal, to recover. Why? How? Because this inflammation activates the repair genes, which induce production of antioxidants. And with antioxidant, the immune system is efficient. But if by chance the inflammation stays more than 5 days, then the effect is inverse and the inflammation becomes harmful. Why? How? Because too much inflammatory cytokines will produce oxidant. And this oxidant, they will make the immune system deficient. And then we will have issues into the bone healing. How do we repair the cells when we have a damage? We know that we need to activate the repair genes. We have in our cells 500 genes only for reparation, only. But we have one molecule which can activate these genes, the NRF2. This molecule is very important because it will induce what? It will stop the inflammation. This is why when you have an injury, you start the inflammation, but this inflammation must stop early. And how to stop the inflammation? With antioxidant, again. Then we need to talk about what is an oxidant? It's a molecule that lost 1 electron or more, simply. And then it becomes very toxic. 1 electron to change the life of a molecule. And what is an antioxidant? It's a molecule that will provide the missing electron or the missing multiple electron, simply. And the life, the good life, is when we have a balance between the production of both oxidant and antioxidant. If you say that you are healthy, means you have a good balance. But sometimes we cannot achieve this balance because we produce too much oxidant or we don't produce enough antioxidant. And we name this situation oxidative stress. When you have too much oxidant, we know what happens. The oxidant, they attack the cell's membrane, they attack the DNA. But if we have too much oxidant, then the immune system will be deficient. The healing will be compromised, and this is why you will meet more complication of failure, because of this oxidative stress. Increase of oxidant in osteoblasts is the critical component of the bone loss. When we have too much oxidant, we know that the immune system is deficient, and then we see an increase of osteoclast, and inhibition of osteoblasts, leading to what? To a continuous bone resorption by the failure of the bone remodeling. My friends, the only one mechanism of the bone loss is the failure of the remodeling. Only. You don't remodel, then we lose the volume, step by step. And then for us, clinician, because we are clinician, when we meet a bad outcome, we can answer now. Why? When we meet a bad outcome, it's because we have too much oxidant. That's it. Because too long-term inflammation and this excess of oxidant will induce an immune deficiency. You can understand that if the immune system is deficient, infection is facilitated because the defense is not good, the defense is weak. If the immune system is deficient, we meet more resorption. But now we understand why we meet fibrosis. Long-term inflammation will induce fibrosis. When you come back to a site and you meet fibrosis, because the inflammation did not stop at the 5th day. You can see this is after 8 years, and then arises a time where the non-integrated bone want to be expulsed. When you meet fibrosis at the beginning, even 8 years after, it will not osseointegrate. The fibrosis that you get will stay the whole life. And this is why we need to reduce the time of the inflammation in order to avoid the fibrosis. Then we can explain all the complications. Diabetic and smokers. Why these people, they meet too much complication? Because they are in oxidative stress, simply. What is the issue with diabetes? Diabetes is a chronic inflammatory disease. Diabetes is a chronic inflammatory disease first, before to be a disease of glycemia. And this is why, even if the diabetic are following a strict diet, they will meet complication, neurologic, etc., because of the chronic inflammation. And then they produce too much oxidant. What is the issue with the smoking? The issue is the smoke. Why you don't smoke into the restaurant? Because the smoke attacks the antioxidant of the gum, of the skin, of the lung. This is why we cannot smoke in a public zone. And this is why smokers, they don't heal well, because the gum is oxidized. Because the gum oxidized will induce bone resorption below. This is the issue in the smokers, is the oxidation of the gum. We can understand the allergy to penicillin. We know that complication in this patient is almost the same with diabetics and smokers. The same. Why? Because we need to understand that allergy is an immune disease, simply. And what happens when the patient has allergy? We know that the T lymphocytes, they produce continuously inflammatory cytokines, making a long-term inflammation, inducing production of oxidant. We understand that. But the allergic are deficient in vitamin D, and then they don't produce enough antioxidant. And then we understand that people allergic to penicillin are in oxidative stress, like diabetics, like smokers. And this is why they will meet same rate of complication. We do bone management and we meet some resorption of fibrosis. We can explain now. When we do an augmentation, what is the issue? The issue is the soft tissue, not the bone. The soft tissue, because if this soft tissue is thin, then the bacteria, they penetrate. We know that the bacteria, they penetrate in thin soft tissue. And if they penetrate, they induce inflammation. Logic. What happens when you have inflammation? Oxidant. Oxidation of the bone graft, because the gum releases a lot of inflammatory cytokines. And we know what happens when we have oxidation, fibrosis, or resorption, or both. Today we can explain everything in the bone management. They ask us to place a membrane, a collagen membrane. But now we understand what is the function. The collagen membrane is not definitely a cell barrier. Collagen membrane is an immune barrier. When you have a soft tissue inflammatory, then the use of collagen membrane is beneficial. But if your soft tissue is not inflammatory, if your soft tissue is sick, you don't need the membrane, because you have the best membrane in the body, which is the periosteum. Periosteum is a collagen membrane. In Germany, we have the best leaders in autogenous bone grafting. And these people, they believe that they don't need to use other material because they use autogenous bone. No. If the soft tissue is not good, if the soft tissue is thin, they will meet resorption. The resorption is coming from the soft tissue, not from the quality of the material. And we need to adapt now our knowledge to what we learn from the osteo-immunology. We induce a foreign body reaction when we put a material. You know that. It's logic that human is the best because we don't induce any immune reaction from the body, because antigenicity is the same. You put a human material, even if it's autogenous, then there is no immune reaction. But the problem with the human bone is how to harvest, etc. Today we have a good solution, which is the porcine material. Porcine material has almost the same antigenicity. You know that today the cardiac valves that we put into the heart are from porcine. We started to graft full heart from porcine. It's the only one material that is accepted by the body without too much immune reaction. And then if we use a synthetic material or bovine, you understand that these products are too much inflammatory. And then they will induce oxidation because they induce a long-term inflammation. And today we understand why sometimes we meet connective tissue, fibrosis, encapsulation, because of the long-term inflammation, simply. We can explain everything today. We can meet oxidation, production of oxidant, with ischemia. And then we need to explain how a tissue turns ischemic. From Mamoto in 2009, we know that pressure or tension will lead to loss of vascularity. When you press a tissue, the tissue loses the vessels. When you pull the tissue, too much tension, the tissue lose the vessels. And then we understand that when we have tension, like a short vestibule, we understand why we lose the bone. If you meet a peri-implantitis, it's because there is no vestibule, simply. No vestibule, tension. Tension, ischemia. Ischemia, oxidation. Oxidation, bone loss, simple. We understand that when we place an implant, we need to take care about the torque. But the torque is not felt in the same way. What does it mean? The bone behaves to pressure according to its density. When we place an implant into a cancellous bone, this bone is flexible. And then there is no oxidation because there is no ischemia. When you place the implant into the cortical zone, then this bone is rigid, and then the pressure will induce ischemia and then oxidation. And the critical zone when we place an implant now is the cortical zone. Why? Because this cortical zone has no plasticity, has a poor blood supply, and then it will be oxidized by the pressure. And we understand why we meet sometimes the margin bone loss. The margin bone loss is just the pressure from the implant on the cortical bone that cannot support the pressure. When you see peri-implantitis into the X-ray, only the cortical zone is resorbed, never the cancellous. When we have a sick cortical, because sometimes we have too much cortical, what happens? We will meet a fracturing. Because the cortical zone does not support any pressure, any pressure. When you see this, it's because you have too much cortical and too much pressure. We want to place implant into the bone graft, and we must now understand that the bone graft is not flexible. The bone graft behaves as a cortical bone, and then any pressure will be fatal. Any pressure on the graft will be fatal. We will come back later. Then we understand how we lose the bone because of the immune reaction, then how to improve the immune system. By antioxidant. We can improve the immune response by antioxidant because we know that immune system fails when there are too much oxidant. First is the NRF2 activator, because we need to go into the cell, into the genes to activate the antioxidant production. This is the key of the healing, the key. Then if we have the antioxidant, then the life is much better. Okay? Vitamin D is the most powerful activator of the NRF2. What does it mean? If you want to increase the antioxidant, the best product today is the vitamin D. We know the influence. Since more than 15 years, I'm traveling all over the world just to ask all the please, test and supplement. Never do a surgery without testing, please, because it's so important. When you lose the bone, because you cannot remodel the bone enough. We have other activators for the NRF2. We have the vitamin K, vitamin C, melatonin is a fantastic hormone. We have the zinc. You know that when the patient is deficient in zinc, there is no immune response. It's a nightmare. But we have other pathways to produce antioxidant. We know that the microbiota, probiotics, in order to improve the microbiota, vitamin E, copper, magnesium, omega-3. Everybody knows this, all this. But you see that if you want to ask the patient to take all this product, it's a bit difficult. And this is why, yeah, because, hey, doctor, this is not a list of medication. And this is why during the COVID, I wanted to design the product that will help us. I designed already a product which is the Immune Force since the COVID. To do what? To improve the immune system with all this product. Very simply, 1 pill a day from each vial, you know. They take 6 pills every day, 2 months. And then they go with a very, very powerful immune system. Then what they do? They produce enough bone that you want. They heal as so fast because they have too much oxidant. But can we improve with antibiotics? This is a good question. Can we improve the immune system? Of course, because we know since now 40 years that we have some antibiotics that are improving the immune reaction. Macrolides, they are doing immunomodulation. And during the COVID, if you remember, we were using only azithromycin. My question was, why do they use antibiotics? COVID is a virus. We know that virus are not sensible to antibiotics. We were using azithromycin because it was the most powerful stimulation of the immune system. This is why azithromycin was used. And then I said, I need to test in clinic as soon as possible. Unfortunately, after the lockdown, patient came for an augmentation. He was allergic to penicillin, not too much, very well prepared, because it was 2 days after the end of the lockdown. And 6 days after, he came back with an abscess, huge. Why 6 days? Never 4, never 5. Infection comes after the 5th day, all the time, because at the 5th day, you have the collapse of the immune system, and then the infection starts. You will never meet an infection before the 5th day, never. Because during these 5 days, you have the positive action of the immune system. So he came with a huge abscess. What to do? Surgeon called me and said, do nothing. Really? Yeah. Do nothing. You are crazy. No, give him azithromycin, just to see what happens. 2 days, please. Give him just 3 pills a day, 3 pills today, 3 pills tomorrow. But please give him vitamin D, it will help to improve the antioxidants. And the surprise that 2 days after, the abscess was gone. 2 days, no abscess. 1 week, full healing. Wow. But the surprise is 3 months later. The graft was a success. The first time in my life, because I'm a surgeon, that after an abscess, after an infection, I see that the graft was a success, just with 3 pills. First time in my life of surgeon. And then we started, what? First to analyze the literature. We have 2 kinds of literature. The literature after the COVID and before the COVID. After the COVID, what is the conclusion? Azithromycin inhibits oxidative stress. Very good. This is what we want, to reduce the oxidant. But azithromycin is more efficient than amoxicillin. Today, for example, in France, most of the people, they left from amoxicillin to azithromycin. But what is the literature before the COVID? What do we know since 40 years and we didn't take care? Because the publications were done 40 years ago. Azithromycin is stored into the soft tissue, and the concentration in the soft tissue is from 50 to 200 times more than in the blood. Can you imagine that this product is in a very, very high concentration in the gum? For me, it was evident that we need to put it into the gum. And then we started to start protocols. This is the updated protocol. We prescribe 1 box, 6 pills. Simple. Any kind of case. We give them two pills the night before, 2 pills or 2 capsules in the morning, and we give them 2 capsules at the 5th day. And you understand why at the 5th day? Because it's the day where we need some time to help to reduce the production of oxidant. But we know that the gum is the main responsible. When you get infection into graft, it's from the gum. Then, if the gum is not good, means the gum is very thin. If the gum is inflammatory, then we give them azithromycin weekly, 2, 3, 4 weeks more. We give them 2 capsules for a week because 1 dose is active for 1 week. We know that since 40 years, that when we give azithromycin, 1 dose is active for 1 week. And this is what we do when we have a thin soft tissue or inflammatory soft tissue. We give them weekly during 4, 5, 6 to help the patient to reduce the oxidation of the gum. But what the gum loves most? Azithromycin on the sticky bone. Locally. Yeah, I said if the azithromycin is going to concentrate itself into the gum, let's put the azithromycin in the gum, just below the gum. How to find the powder? My friends, you go to the pharmacy and you buy the bottle of azithromycin for kids. It's a suspension. And then you put a little bit on the side. I want to show you how the gum loves it. Look at the inflammation of the soft tissue after 4 days. There is no inflammation after 4 days. Even when we have a huge inflammation at the beginning, look at after 3 days. What does it mean? It means that at 3 days, inflammation is gone. Look at the gum after 5 days. We never saw this kind of gum before. Never. What does it mean? What is the lesson? As the healing is fast, as the healing is beautiful, as the tissue is beautiful. And this is important. Look at this case. Only 6 days in a full arch. Look how the healing is so fast. But if the healing is fast, the tissue is absolutely fantastic. Can we improve the patient with another technique, with the autophagy? What is autophagy? Autophagy, Ozumi got the Nobel Prize in 2016 because he showed that when a cell is in fasting, then the cells start to remove all the negative elements, unwanted substance, oxidant. The cell is cleaning itself just by stopping to get food. And today we have a huge evidence that this we can make detox by stopping to eat, and we know that today we have improvement of the innate adaptive immunity, and we have the improvement of the angiogenesis. Then the question is how to induce. Simply by doing intermittent fasting. You know that. What is intermittent fasting? Is to do not eat during 2/3 of the day. 16 hours at least. No food. Oh. Is it difficult? No. Just by missing the breakfast. If you miss the breakfast, you are in fasting during 16 hours at least. And it's very, very helpful. People, they love it. They love it. We ask them to be in intermittent fasting for the surgery. I'm talking on the surgery. 5 days before and 5 days after. But you will see how many people they will come back to tell you, doctor, you know what? I'm feeling so well, I will not stop. Because they feel much better. So, we saw how to improve the immune system by antioxidant, by intermittent fasting, but now we need to avoid the dysfunction of the immune system. No tension. Of course. We need to release enough. We need to make apical sutures in order to remove the tension. We need to avoid the pressure on the crestal zone. I told you how to avoid the pressure by making an over-drilling. Brademaerk, 40 years ago, he designed the countersink for doing what? The over-drilling. This is still valid. The lesson from Brademaerk is still the same. Don't press the cortical zone in order to make a gap between the implant and the bone. Then you are sure that there is no damage. On the cortical, 2 millimeters only. We need to reduce the inflammation. We know that this is what we were doing before, putting some saline on the bone graft. Today, we use the sticky bone. Because this is a new era of bone grafting. It doesn't matter if it's in the socket or for bone augmentation. We don't use granules like that. We use granules completely stick it into the sticky bone. And because the fibrin will help us to produce new vessels. This is how we manage. We don't manage granules, we manage a piece of bone graft. And the sticky bone is a true revolution in the management of the bone augmentation. But even in the socket, we put the sticky bone the same. And then we cover with the PRF. And we have today the update. Because PRF was designed 25 years ago, but today what is the conclusion from the science today? It's an antioxidant. Yeah, PRF is first antioxidant. And this is why it's good. This is why it helps to heal. We need to minimize the foreign body reaction. What is the foreign body reaction? Inflammation long term. We told you that some material, they induce long-term inflammation. Human is good, but human we are missing some resorption. And today, we are so happy to use a porcine material, which is a xenograft, but with low inflammation. And this is a revolution into the field because it's very new material, since only 3-4 years. But it's a huge change in the behavior of the site because we don't meet any inflammation. And if we don't meet any inflammation, means the bone is growing very, very fast. I will show you. What are the benefits? If we stimulate the immune system, then we can leave the site open without fear of infection. Today, in many, many cases, we leave open the site. Why we leave open? In order to produce more keratinized tissue for free, without fear of any resorption or infection. We can leave open. Why? Because this is very difficult to close. We don't care. When we cannot close, we leave open. We don't try to pull the tissue because we know what will happen. We will close and we will produce the soft tissue and the bone. This is the case of my daughter. She is dentist. She cannot close the site. Bone augmentation. She doesn't care. Leave open. Why? Because this is what will happen. The site will close and will produce more keratinized tissue. We don't have a good soft tissue, no problem. We leave open. Why? Because in this gap, we know what will happen. The gum will come to produce a new keratinized tissue. When we have a short vestibule, we can make the incision and we can place the fibrin into this exposed site. We fix it, but in only a few days we will get the new keratinized tissue without any graft. This is the revolution in today the dentistry. Is now that we leave much more often the site open. So the first lesson, you understand that, my friends, now immunity is mandatory. We cannot live without. The second lesson is that we understand how we lose the bone because we have an immune dysfunction and then we fail into the remodeling and we lose the bone. Then it's easy for me to say peri-implantitis is an immune disease. Yeah. We are asking the question since 20 years. We have the answer in the literature, but not dental literature, in scientific literature. But I want to explain you how this immune disease occurs. We know that we lose the bone because we have the immune deficiency. Maybe because we have a chronic inflammation, or too much pressure, or too much tension, or incompetency from the soft tissue. I will explain. First, peri-implantitis is coming from chronic inflammation. Yeah? We know that when we have a chronic inflammation, we have high level of oxidant, then bone loss. And we know all the situation where you will lose the bone. Diabetics, allergic, obese, smokers, cholesterol. These people, we cannot change them. What can we do? Just to increase the antioxidant. When you have a diabetic in your office, you cannot change, but you can help them to be a better patient. And how to be a better patient? By increasing the antioxidant. I gave you the solution already. Pressure on the bone. We know that pressure on the bone will induce oxidation and bone loss. Who is responsible? I'm sorry for you, my friends, it's you. We don't see that in the literature of peri-implantitis. I can say you are the responsible of the peri-implantitis when you place the implants with too much force, too much torque. No pressure on the crestal bone, my friends. Yeah, you have two kinds of mandible. In this case, can we place? Yes. Can we put 35 Newton? Yes. Can we load immediately? Yes. Because the implant is far from the cortical. And in this case, can we place the implant with high torque? No, never. Can we make immediate loading? No, never. You understand why? Because in this case, if you do it, you will lose the implant after. In the bone graft, when we come back to the bone, we said bone is not flexible. Then we must put the implant very slowly. This is why we meet so often bone loss after the bone graft. Look at this case. Augmentation, you see, augmentation, classic, but the patient wanted to wait 1 year. Why? I want to meet a strong bone, very dense bone. And then I lost everything. We need to place the implant into a soft bone. We need to go to re-enter very early, not to wait too much. We wait only 3 months in France, no more, because we have a good president today. Then we don't wait. No, we don't wait because we don't want to place an implant into a dense bone. And then we do the low torque because we never do immediate loading into the bone graft. We overdrill again, like Brandmark told us. And then we can get the stability after many years. Chronic tension. We know that if you do a surgery and you leave the tension, the patient will meet oxidation and bone loss. Who is again the responsible? You. I'm sorry. No, just to tell you that this is a wrong surgical protocol. We need to over-release, we need to make specific sutures in order to remove the tension. And then we go to the incompetency. What does it mean, incompetency? It's the incompetence to avoid the penetration of the bacteria. Who is incompetent? The syn biotype. We know that the syn biotype, bacteria, they move in. Then let's go to see the literature. What is the frequency of the syn biotype? Look, 1/4 of men, half of women. A lot. What does it mean? You have 1/3 of adult, 1/3 in your office, they have a syn soft tissue. It means that these people, they will make peri-implantitis, mandatory. Because they don't have the soft tissue to stop the inflammation. And then you as a good surgeon, in these people, you need to reinforce to make a soft tissue grafting in order to increase the thickness, in order to make the soft tissue competent. What is a soft tissue competent? It's a soft tissue which is not penetrated by bacteria. Otherwise, you will lose the implant. And you will say, I'm not lucky. No, you are not lucky. You forgot to do something the day of the surgery. So finally, I will say, who is the great responsible of the peri-implantitis? You will never see in the literature. It's the surgeon. Because he is managing a wrong protocol. Then all the pieces are in place. What does it mean? Now we have a puzzle with the osteo-immunology science. We have a very clear view of the field. What do we want? We want a stable tissue. What does it mean? It means that this bone remodels. How it remodels? By doing both osteogenesis and osteoclastogenesis. What is the first condition? Is to have enough antioxidant. This is the main condition of the stability of the bone. Why? Because with the antioxidant, you will get the immunity. How to increase the antioxidant? By the vitamin D, I showed you already, PRF, immune supplementation. When we have the antioxidant, we will get the immunity. How to avoid the bad immune response? To do not use an inflammatory material. And today, we need to remove the synthetic. We need to remove the bovine. It's a huge information for you in Germany, because a lot of people in Germany, they are using bovine. In France, it's not the case. And when you get the immunity and the good immune response, you will get the vessels. Because this is the goal. With the vessels, you do whatever you want. But I will tell you, please, 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 when you get them, don't kill them by making a wrong surgery. Leaving tension or putting the implant with high torque. Yeah, today the lesson from osteology is that we can meet a quick osseointegration. We don't need to wait 6 months, 9 months. 2 months and a half is too much. You know how much it takes the tibia to heal? 6 weeks. 6 weeks. Then 2 months and a half is too much. Can we do it in 2 months? Yeah, but 2 months is still too much. Can we do it in 6 weeks? Yes. Okay, then we do something that is exactly the time of the biology. Means we don't make anything wrong. We can heal it only after 2 months. This is what we do today in France. We wait 2 months to reopen a big augmentation in the maxilla, which is unbelievable today. You cannot do it with bovine or synthetic. How much time we wait for a vertical augmentation in the mandible? They say usually 6 to 9 months. We wait only 2. Because at 2 months you have already the bone. The bone is not very strong. We don't care. We like a soft bone. Because we don't charge, we don't load the implant immediately. Then we wait 2-3 months later. But after 6 months, everything is done. Implants, bone graft, prosthesis, etc. I want to show you a case that we did in June because we had this is an augmentation in the mandible. It was a live surgery during the Congress in June because I do every 3 years my Congress. Why 3 years? Because we need time to organize a good Congress. Congress every year. Okay? Then we do the augmentation with this kind of mesh. We stabilize the mesh with 2 screws. Then we go to place the sticky bone and we cover only with PRF because the soft tissue is good. We don't need to place a collagen membrane. Okay? This is how we manage this live surgery, and this is after 3 months only. Exactly 3 months, 90 days. Look at the site. Look at the quality. But when we have inflammation in the soft tissue, we place a membrane. We don't joke. Inflammation, membrane. No inflammation, no membrane. That's it. And then, even if we place a membrane, we have a very good outcome, and we don't wait too much. So now we can talk about the long-term stability. This is the lesson from the Osteo-immunology. The lesson from the Osteo-immunology is, okay, what we do everything that I showed you. No pressure, no tension, we control the biology, we do everything. For what? In order to achieve a competent soft tissue. The goal is to get a competent soft tissue. What is a competent soft tissue? Big, thick. Because when you get this, when you do a good surgery, what happens after 15 years? Nothing. Nothing. Why? You are a good surgeon. I told you, most of the cases, the complications are coming because we do a wrong surgery. Even after 14 years, what happens? Nothing. Nothing. Even after 13 years, what happens? Nothing. And you understand today that my lesson today for you is, let's go to improve the surgical time. 1 hour only. If we do better, we will increase the outcome. Don't believe that it's a material or some, no, your hand and connected to your brain. If you do a good surgery, if you make your patient powerful, you meet stability. Last case. Look at this case. Huge augmentation in the mandible because 2 successive failure in implants. Patient came. Because we are doing this since 20 years. All the dentists, I'm not dentist, but I'm the advisor. Vertical augmentation, placing implant at 4 months. The bone graft is very soft. We love it. Then let's go to see 20 years. 20 years. What do we see? Full stability. But look at the bone level. At the first implant here, look at the bone level. Perfect. 0 bone loss. Implant number 2, 0. Implant number 3, 0. Implant number 4, 0. Interesting that we can control the bone stability over time. Because we know what we should do the day of the surgery. We make the decision the day of the surgery, my friends, not after. And this is why, my friend, I ask you, all the time, during the day, and from the day to the night, means during 24 hours, think Osteo-immunology. Because if you move into this science, you will see how your result will be so improved. You will be so happy Because now you understand what you do and you understand what you meet. So I need to make for you a gift, my friends. This is a QR code. What is this QR code? This QR code, if you take the picture, will give you the possibility to watch this lecture again. I recorded the lecture for you, because you know how a French can come to Germany without a gift. Okay? Then you have this is my YouTube channel. You can take this link, or you can use the QR code, and then you can rewatch this lecture if you want to understand maybe more. Thank you, my friend, for your attention. Thank you.
Thank you very much.
Thank you. Thank you. Thank you.
You're going back to Nice today?
Yeah. In 2 hours, I'm moving.
Oh.
You know why? Because I have a wife. I want to tell you. I told you about pressure. And what is doing my wife? But all the wives, they have, it's innate, like the immune system. They know how to make pressure on their husband. And then, thank you.
Well, thank you so much.